Good day. I'll be speaking to you today about the stepwise approach towards rabies elimination, or the SARE tool, which is a assessment, monitoring and evaluation, and a tool that is used to develop strategic plans towards rabies control and elimination. So my name is Dr. Terence Scott from the Global Alliance for Rabies Control, and I'm the technical lead for rabies as well as a member of the SARE Development and Revision Group. So looking at this map, the countries in blue are those countries that are endemic for dog and human-mediated rabies. And we can see that these countries are scattered throughout the developing world, primarily in Africa and Asia. So looking at rabies elimination, can it really be done? So we know that getting adequate vaccination coverage in dog populations is in fact a complicated process. It's not as easy as some people say, where you just vaccinate a dog. There are a lot of other considerations that need to be looked at before you can get that vaccine into that dog. And we've seen that there have been focused campaigns that have been ongoing for many, many years, and yet rabies transmission still persists. So what are the considerations for rabies elimination? If we look at the themes in this webinar alone, there are 4 different themes with multiple different presentations and approaches, all of which are valid and important information that is critical for rabies elimination. And this includes pathogenesis and immunity, rabies prophylaxis in both humans and dogs, rabies epidemiology and public health, and innovations for treatment. However, there are far more themes and considerations to look at, including diagnosis, dog population management, legislation, and many, many other themes. So we can see that it is a very complicated process, and there are a plethora of different tools and information that is available. But if you have limited resources, which the majority of countries which are endemic for dog and human human rabies have, in fact, how do we go about prioritizing these activities? So which tools or approaches do you use first? Which is the most effective tool for your current situation? And what will be most impactful presently? So if you only have limited resources and you need to gain that all-important political will, how do you show the most impact at this point in time with one of those tools or some of that information? And also taking into consideration that many tools require baseline information or some information to then put into these tools to make them effective. And now, is that information actually available to you? So the SARE tool helps to identify where to start the process of eliminating rabies, and then also identifying how far a country is, in fact, in their efforts. So in 2015, the international community for rabies developed the global framework for the elimination of dog-mediated human rabies. And this is where the 2030 goal first originated. And this global framework was based on 5 different pillars, ranging from socio-cultural, technical, organization, political, and resources, making it the STOP-R framework. And if we look at this framework, there is some detail, but unfortunately, looking at these different activities and different criteria, there's not enough detail to truly help a country to develop a clear and strong rabies elimination strategy. So what does the SARE tool itself do? The SARE tool provides a practical guidance on how to start or expand all the rabies control activities that are needed to control and eliminate dog-mediated rabies. It provides a foundation for the development of a clear, well-constructed national strategy, and it consists of specific activities that provide measurable steps in a chronological order. So importantly, it's about assessing where the country is and then developing a clear strategy that is specific for the country itself in a chronological order that makes the most sense to achieve elimination. So the SARE tool is a truly One Health-centric tool, as it considers all the stakeholders and their roles in rabies, including the ministries of health, of animal health or agriculture, environment, education, legislation, NGOs, international organizations. All of these partners, all of these stakeholders are typically involved in the development and the use of the SARE tool and the development of a practical plan and a national strategy towards achieving that all-important goal of 0 human cases from dog rabies by 2030. And it helps governments, the tool itself helps governments to prioritize these different activities, selecting which is most critical to achieve now and which can then be moved to a later point in time because they require that baseline amount of information, or they require something else to be achieved first before they can be addressed. So it develops a very strong foundation before progressing to the next stage by prioritizing these activities as mentioned. And it ensures, importantly, that all aspects of dog rabies elimination are addressed, making sure that countries aren't only focused on prevention and control, but also consider things like diagnosis and community awareness and education activities too. So again, going back to the themes for this webinar, as I mentioned, there are multiple different themes already for this webinar series alone, including pathogenesis and immunity, innovations for treatment, rabies epidemiology, and public health. And you can see that this falls into 2 main themes of the SARE assessment, 2 of 7 different SARE components that are available, ranging from prevention and control to legislation, to dog population management, to information, education, and communication, among others, as I mentioned. And this addresses all the different aspects that are required for an effective rabies elimination strategy. And is broken down into these 7 different components, and under which there are various different activities within each component. So what does the SARE tool actually do? So you go about by looking at each of these different activities within each of the 7 components of the SARE tool, and you either answer either yes or no to specific questions that have been developed. And these yes or no answers then help to identify accomplished and pending activities. If the activity has been accomplished, you answer yes to having achieved that activity. And if it has not been accomplished, then you answer no, and that remains a pending activity that needs to be completed before you are likely to achieve rabies elimination. And importantly, the SARE tool itself automatically generates a SARE score based on the completed activities. So all the activities that you mark as 1 or yes, as having been completed within your country, that then helps to develop an automatically generated score, which I'll go into a bit more detail in a bit later on. So looking at the tool itself, it's an Excel-based tool, so it's available for use on any computer and it works on any computer. It's very easy to use, and that is the point, is that it can be used by any country, by any stakeholders within the country to assess the situation themselves, and is then not reliant on input from external organizations or bodies. There's a full training toolkit that is available, including protocols, videos, facilitators' guides to help them, people within the country facilitate workshops. There's a concept note as well as an agenda and all sorts of other information that will be essential and very helpful to running an in-country SARE workshop where all the facilitators and all the stakeholders can be involved. You can also see from this diagram on the right-hand side that the SARE tool is broken into 2 different components, the top half being the assessment aspect, and the bottom half will be the development of a work plan, of which I'll go into a bit more detail later on. So how does the SARE tool actually work? So initially, countries are then asked, or national governments are then asked to develop a report, of which there is a template within the toolkit also, of the current situation of rabies within the country. What is known about rabies in the country? And then that information is then used to answer the various different questions within the SARE assessment itself. And as we mark answers as yes or accomplished, that then generates a list of completed activities, and these completed or accomplished activities are used for advocacy purposes, to promote the good work that has already been done within the country and to promote the efforts and that the resources that have gone into rabies elimination have been effective, and that the strategy and that the action is moving forwards towards that 2030 goal. The next part is then the identification of those pending activities, which are all the activities that you answered as 0, and then the SARE score, or the country stage. So looking at the SARE score itself, this is an output of a fictitious country, just an example country that we developed using the SARE tool itself. And you can see that this fictitious country is at stage 1.5. On the left-hand side, you can see an activity summary, which is a summary of each of the different components and the number of activities that have been accomplished and remain pending within each of those different components. And you can see it as an example right at the bottom. Legislation is extremely strong in this country, where they have 10 accomplished activities with only 3 remaining as pending, whereas, for example, information, education and communication is relatively weak, with only 5 accomplished activities and 16 still pending. And this summary immediately helps countries to identify their strengths and weaknesses within those different components, showing that this country may have focused a lot on legislation, but less so on actually educating the public, on training their professionals, and all the other aspects related to information, education and communication. On the right-hand side, we can then see the stage summary, which is a breakdown by SARE stage. And you can see that this country has a very strong foundation, as all of the 0 and 0.5 activities have been completed, all 6 of them. And the majority of stage 1 and 1.5 activities have been completed, 34 out of the 44 activities, which means that they only have 10 more activities before they have an extremely strong foundation to then build on and progress towards that 2030 goal. So looking at the SARE score itself, or the stage score, we can see that this is the diagram that depicts that information. And stage 0 is a country that would have very little to no information on rabies available, but rabies is suspected to be present. Stage 1 countries would have an assessment of the local rabies epidemiological situation, and they would be developing a short-term rabies action plan. So they would have some activities in maybe small-scale areas and localized areas, some pilot projects to determine the effectiveness of various different techniques, but they have not yet then developed to stage 2, which is the development of a clear national rabies control and elimination strategy. And again, the implementation of the strategy in localized areas. Stage 3 is the full-scale implementation of that national strategy that's been developed at a nationwide level. So ensuring that the activities are expanded to all the different areas across the country. And stage 3 is also progressing towards the elimination of dog-mediated human rabies cases. So there are very few human rabies cases remaining in the country. Stage 4 is then the freedom from canine-mediated human rabies cases, and also then progressing towards the elimination of dog rabies cases. And stage 5 is then the freedom from both human and dog rabies cases in the country. And if we remember that the 2030 goal is actually only at stage 4, which is freedom from canine-mediated human rabies cases. So we consider that the various different countries only need to reach stage 4 to achieve the 2030 goal. So looking at the SARE score shows a clear progress, or in fact the lack thereof, if that is the case, within the country towards that 2030 goal, and beyond, of course, to the elimination of dog-mediated rabies in the country. And it allows countries, or in fact regions, as this tool can be used at the regional level, at the local level, to measure their progress on any time frame. So it's advised that the tool is repeated maybe every 2 years to show this progress over time. As activities are then accomplished, you then do a reassessment and reevaluation of the current situation, and hopefully you'll then see that your SARE score changes and progresses along that SARE ladder towards stage 4 and stage 5. And that's extremely important to show progress over time and that the resources that have been invested into the rabies control activities are then showing tangible proof that progress is being made. So I'm going to diverge very briefly to the Canine Rabies Blueprint, and you'll understand soon as to why I'm speaking about this, because the Canine Rabies Blueprint is integrally linked with the Stepwise approach towards rabies elimination tool. So the blueprint is a user-friendly, web-based information repository that consists of contributions from various different experts globally, from international organizations to non-profit organizations to national governments, have all contributed towards the Canine Rabies Blueprint. And this provides hyperlinks to more detailed information and documents. So the blueprint has information on collecting epidemiological data, what needs to be procured for vaccination campaigns, how to estimate the dog population, who needs to be trained and in what specific jobs, among various different other categories and various different information that is available. So as an example, we can see that there are guidelines that are downloadable, there are international regulations, there are peer-reviewed manuscripts that are also available for download, and links also to journals and publications about all the different aspects related to rabies control and elimination. So for each and every question in the SARE tool that a country needs to answer in their initial assessment, there is also a hyperlink directly to the Canine Rabies Blueprint, which shows you then how to go about achieving that activity. So that then leads into how do the SARE and the Blueprint fit together, and it's exactly that the SARE and the Blueprint are complementary tools, and the SARE shows you where the gaps are in each stage towards elimination and what you need to do to progress. But the Blueprint then shows you in detail how to go about filling those gaps and progressing to the next stage. So in the SARE tool, you might identify that you need to improve community education, but the Blueprint shows you exactly how to go about doing that with various different resources that are available, various different techniques that have been used in different countries or by different organizations as examples on how to go about doing this. So as is descriptive in the name, the Blueprint itself is the plans or the blueprint on how to go about doing that, and the SARE tool itself is assessing and actually implementing those different informations and activities. So now we've done the SARE assessment, but what do we do next? Through the SARE assessment, as I mentioned, you then get an output of activities that have been accomplished and those that are still pending. And we may have a long list of activities that are still pending. So how do we go about prioritizing these different activities and developing a clear plan to achieve that goal of 2030? How do we go about selecting that this specific activity is more important at present than another activity? And how do we choose with those limited resources that are available in the majority of canine rabies endemic countries? How do we go about choosing which should be prioritized with those resources? So looking at the SARE assessment again, as I mentioned, we have that long list of pending activities, and we then need to decide on how to go about completing them, who will complete them, and when this will be achieved by. So what the SARE tool does itself is it imports that information, all those pending activities, into a practical work plan and automatically generates a work plan based on the completed SARE assessment. Countries then go about fully customizing that document to their specific needs. So in a specific country or in a specific situation, there may be slight differences within the work plans that are automatically generated, and countries can then fully adapt and customize the tool to their own specific needs and requirements through a SARE workshop. We then also look at additional tools that may assist, such as the Global Dog Rabies Elimination Pathway, or the GDREP tool, which helps to have a costing component for advocacy purposes towards this strategic plan that is being developed. And the outputs from the development of this strategic plan include Gantt charts, specific timelines, key performance indicators, deliverables, and outputs also. So the practical work plan itself is developed based on those pending activities from the SARE assessment, so those activities that have not yet been accomplished, and it's automatically generated yet fully customizable by the country. So from experiences and from lessons learned from various different countries, developing a clear work plan based on a national strategy can be a very time-consuming process and can take months or weeks at least of very focused and detailed workshops. And the key part of this tool is that the practical work plan is automatically generated as a default work plan within seconds after the SARE assessment, and it can then take maybe 1 or 2, perhaps 3 days to specifically customize this work plan to the needs of the country itself. So it cuts down the timeline required to develop this comprehensive and detailed work plan from several weeks to three or so days. And the outputs, as I mentioned, include Gantt charts or specific timelines, as is demonstrated in the figure on the right-hand side, where there are colors by the different stages, as well as clear timelines on when each activity from the SARE assessment will be completed. There are also specific deliverables, detailed and specific objectives, responsible authorities, which is absolutely critical in the achievement of a clear work plan, as it designates who will be responsible for that specific activity and who will drive that activity. Because if there's no responsible authority, then everyone thinks the other person will be responsible, the other ministry will be responsible, and then nothing happens. And when it comes to doing the assessment, again, there's been no progress, and everyone looks to the other ministry or to the other person as to why it has not been completed. But with the responsible authority, that person or that stakeholder will be responsible for driving that activity and progressing it forward. And there are also then, again, very specific outcomes for each of the different activities. So some of the core outputs is that the SARE tool is a self-assessment. Importantly, it's a self-assessment of the rabies situation in the country. It's not designed for external organizations to then come in and assess how a country is doing. The point is that the country themselves, the national government themselves, assess their own efforts and their own progress towards elimination, making it a very sustainable tool also. As I mentioned, it helps to identify those pending and accomplished activities. And again, critically, I'm going to repeat this, is that it helps in the prioritization of different activities. And there's the development of a clear and practical work plan, which then helps to take these pending activities, prioritize them, and help countries to then reach elimination by 2030. So is the tool itself effective? We can look at this map and we can see that, again, the majority of the SARE assessments have been accomplished in those countries in Africa and Asia. And we can see in orange are those countries where a regional assessment have been done, and those countries in blue are where specific in-country SARE assessments have been undertaken with all the different stakeholders involved in that assessment. So as I mentioned, the SARE tool itself should be repeated relatively regularly, preferably every 2 or so years, to demonstrate that progress over time. And as an example, we can see on the left-hand side of this graph in Benin progressed from stage 0.5 to stage 1.5 after their second assessment. And again, this then clearly shows that there has been progress over time, and that the resources and the funding that has gone into the rabies control activities has actually demonstrated tangible progress and proof towards the efforts of moving towards that goal of 2030. So in conclusion, if we look at the SARE assessment itself, it assesses the situation within the country and highlights the strengths and shortcomings for further action. And then the work plan itself has a very technical focus and helps to prioritize activities over time. And importantly, as I mentioned, it assigns responsible authorities to drive each of those different activities. And it helps to develop a very clear and practical work plan to accomplish those activities required for effective rabies elimination strategy. So the SARE tool addresses all the aspects related to dog rabies control and elimination, and it's a truly One Health tool which includes all the different sectors ranging from human health, animal health, education to legislation, and various different other stakeholders and sectors involved in rabies control and elimination. And it's operationalized through the development of a practical work plan, which prioritizes specific activities, including those activities that rely on a baseline level of information, creating a strong foundation to then build on further towards achieving rabies elimination. And it helps the development of a clear rabies elimination strategy, including a national strategy towards rabies elimination. So I'd like to thank you very much for your attention. For more information, you're welcome to visit our website at rabiesalliance.org, and you can also contact us on info@rabiesalliance.org for any other information or questions that you may have.